Welcome back to Tales from the Lab, a veterinary podcast. I'm Dr. Brad Ryan, Senior Professional Services Veterinarian at Antec Diagnostics.
And I'm Dr. Holly Brown, a clinical pathologist and Chief Veterinary Educator at Antec. Together, we'll be discussing real patients and bring in expert guests to offer deeper insights into the laboratory diagnostics used to solve interesting and challenging cases.
Tales from the Lab is a production of Antec Diagnostics. The intent of this podcast is to provide education and guidance with the understanding that any diagnostic testing and treatment decisions are ultimately at the discretion of the attending veterinarian within the established veterinarian-patient-client relationship.
Welcome back to Tales from the Lab. I'm Holly Brown. Today's case centers around something we've talked about repeatedly in prior episodes, the importance of recognizing a stress leukogram. And perhaps even more importantly, recognizing when it's missing. This is the case of Libby. She's a 2-year-old spayed female Great Dane who initially presented for vomiting and developed aspiration pneumonia. But despite radiographic improvement during treatment, something about her lab findings didn't fit the clinical picture.
What I love about this case is that it really highlights how CDC interpretation is not just about abnormalities being present, right? It's also about abnormalities that should be present but aren't. Sometimes the most important finding is the absence of an expected response, and that's what we have in this case.
I love it, Brad. So Libby initially presented for vomiting, and mom had actually witnessed the vomiting and the suspected aspiration. So when she presented first for her presumed aspiration pneumonia, it was confirmed on radiographs. She was hospitalized. She did improve clinically with the supportive care and antimicrobial treatment, maybe something other specific for her pneumonia. So she had been hospitalized for several days with slow improvement, and then she was discharged to continue the rest of her treatment, oral antibiotics at home. But after discharge, she was home for only about a day and a half or 2 days before she returned for recurrent vomiting, anorexia, and generalized lethargy. The owner described her as acting poorly overall, despite the fact that her respiratory signs actually appeared improved.
And clinically, that's a really important crossroads, right? Because when a dog comes back after hospitalization, still acting ADR, it's really easy to attribute everything to incomplete recovery from pneumonia.
Exactly, especially because aspiration pneumonia can absolutely take time to resolve clinically. But in Libby's case, the recurrence of the GI signs was important because those signs predated the pneumonia itself, right, and how she got into this situation. So on physical exam, she was quiet, alert, and responsive with a temperature of 101.6, so Fahrenheit, so not febrile. She was breathing comfortably, and she only had mildly harsh ventral lung sounds, and notably, no coughing re-presented on emergency, and no coughing overnight that they had witnessed. So overall, her respiratory exam was actually fairly reassuring relative to how poorly she was acting systemically.
So for everyone who's listening, really pay attention to that part because that mismatch becomes important later. If the lungs are improving, but the patient still appears systemically unwell, it forces you to ask whether something else is contributing to the clinical picture that you're seeing.
Exactly. The initial thoracic radiographs, as I mentioned, were consistent with aspiration pneumonia, which fit well with the history of the vomiting and her respiratory signs. At that stage, the diagnosis and treatment plan were relatively straightforward.
And honestly, this is where many cases would stop. The pneumonia explains the illness, the patient improves in the hospital, and everyone assumes recovery is ongoing.
Right. But when she returned after discharge, were the owners concerned of these recurrent clinical signs, in particular, this lethargy, the vomiting, her inappetence, right, really felt sort of crummy at home, a recrudescence. But those repeated radiographs actually showed continued improvement in those pulmonary changes. So radiographically, pneumonia's getting better, yet clinically, Libby's deteriorating again.
And that's really the pivot point in this case because now the imaging and the patient's overall condition are no longer matching.
Right. At that point, the attention shifts towards her CBC and specifically her leukogram. What stood out was the lack of an appropriate stress leukogram in a clearly ill dog. So as we mentioned on previous episodes, often in phases of clinical illness, and certainly the more significant the illness, commonly with intense inflammatory diseases and periods of hospitalization, we see the effects of increased glucocorticoids in that patient. We witness those effects in the leukogram itself as a suppression of circulating lymphocytes and eosinophils. So sometimes they're actually flagged low on the CBC, a lymphopenia and an eosinopenia, or they're at the low end of the reference interval. It's a really sensitive, sick patient test, right? And really common for us to see with any of our patients in clinical illness. So especially, I would imagine, in a dog with pneumonia while she is recovering, right? She's about maybe 5-6 days into illness. She's been hospitalized for 3 or 4 of those days. So a dog, I would expect to see a stress response, right? That suppression of lymphocytes and eosinophils attributed to increased glucocorticoids. But Libby actually had increased lymphocytes and eosinophils.
And I think that's such a critical teaching point because stress leukograms become so expected in sick dogs that we sometimes stop consciously looking for them, right?
Yeah, and I'd argue probably that many people were even missing them before. Would you agree, Brad?
Sure, exactly.
And so in a clinically ill hospitalized dog, especially one in her case with inflammatory disease, I would expect that lymphopenia and eosinopenia. So when they are normal or increased, it should immediately raise concern for potentially inadequate glucocorticoid production.
Right. So that's where we get that term abnormally normal CBC that we hear, right?
Yes, and I really do love that. There's a couple times I think of another one when we talk about dogs with hyperparathyroidism, when their ionized calcium is high and the parathyroid hormone is quote normal within the reference interval. That's one of those as well where the parathyroid hormone in the face of the hypercalcemia should actually be low. So it's abnormally normal. And this is the other one I think of, right? So the, the sick patient lacking that stress leukogram, and really, especially if the lymphocytes and eosinophils are increased or at the high end of the reference interval, that is inappropriate.
Perfect.
So the CBC may not look dramatic at first glance, and actually it might look, quote, normal, right? If things fall within the reference interval or only mild increased lymphocytes and eosinophils, as we saw in Libby's case, but that's actually very abnormal. So at that point, hypoadrenocorticism became an important differential diagnosis. However, she didn't have the classic electrolyte abnormalities that many clinicians associate with Addison's disease.
Yes, and that's where atypical Addisonians can be missed clinically. Because if sodium and potassium are normal, people may move Addison's lower on that differential list and they're not going to be thinking about it at all, probably.
I think you're right. I think people rely on the chemistry profile to make the diagnosis, but I do think if that they tune in to seeing stress leukograms in their sick patients, they're also more likely then to recognize the lack of that stress leukogram and maybe this earlier detection of these Addisonian patients, right? Because it can absolutely exist without that mineralocorticoid deficiency, right? Resulting in the electrolyte abnormalities, but just the glucocorticoid deficiency we might see first, maybe earlier in that disease progression. So they did perform an ACTH stimulation test, and her cortisol concentrations were less than 2 micrograms per deciliter, both pre and post ACTH administration. And I think that that's really important because I'm the one in the hospital, right, that's often going around saying, make sure you check a baseline cortisol, like if I see a lack of a stress leukogram. And oftentimes, if they are Addisonian, we'll get a low pre, and then we stim them and get a low post cortisol as well with the confirmation of the diagnosis. But I will say, surprisingly, we'll get some cases where I'm concerned they could possibly be an atypical Addisonian, and the baseline cortisol is low, the less than 2 micrograms per deciliter. And yet, when they stim them, sometimes the cortisol level comes back much higher, actually appropriately high in response to the ACTH stimulation. So it's always important that we have both a pre and a post ACTH that remain less than 2 micrograms per deciliter in the face of appropriate clinical signs to make that diagnosis.
Right. And then suddenly the entire timeline for this patient makes sense.
Right, because her initial vomiting, right, that even got her into the situation of the aspiration pneumonia may well be a reflection of her Addison's disease, right, with those GI signs. Then she's hospitalized, and in particular, getting IV fluids, right, aggressive IV fluids for her periods of dehydration, and restoring that fluid volume gave her that support she needed, that vascular support to feel better. And then when she was discharged and went home, right, even with her medication and treating appropriately for her pneumonia, the lack of having, I think, that IV fluid and volume support allowed her to get hypovolemic again. And then she had the return of her GI signs as well. And she presented as that lethargic dog that was ADR and anorexic with vomiting again. So one of the major teaching points from this case is that atypical Addisonians may not actually be all that atypical. These dogs may present primarily with GI disease, waxing and waning illness, and the absence of an expected stress leukogram, even while the electrolytes remain normal.
And that's such a valuable reminder because these are exactly the patients that can get labeled as quote unquote chronic GI dogs or dogs that just don't bounce back normally, that kind of thing.
I think you're exactly right. Another really interesting aspect of this case involves the imaging findings. So I had the opportunity to present this case alongside a board-certified radiologist at a conference. While they took the opportunity to look at those radiographs to explain pointers and recognizing pneumonia, I was, of course, talking about the lab work. I love the opportunity to talk about recognizing a stress leukogram in the CBC, or in this case, the lack of the stress leukogram. But I thought it was interesting on the follow-up radiographs when they were reviewed. The radiologist, of course, talked about the resolution of the pneumonia and where that was improving, but also was able to identify on those repeat radiographs a microcardia and decreased pulmonary vascular size on those follow-up rads, right, supporting hypovolemia, which can be seen with their differentials, dehydration, shock, blood loss, and importantly, hypoadrenocorticism.
And I find this really fascinating, Holly, because the radiographs were initially being evaluated primarily for that pneumonia progression, but they ended up providing clues pointing toward Addison's disease instead, which is just brilliant.
Yeah, I think it does underscore probably an opportunity that radiologists really can add a lot of expertise beyond. I think we look as practitioners and we're looking at these radiographs next to our patients. Sometimes we can become a little too myopic. In this case, we were looking just for, is there progression or resolution of the pneumonia, and missing things like heart size and pulmonary vascular size, right? That having that reminder or having access to a radiologist so we can send them for review can provide additional insights.
Completely agree.
In this case, the imaging findings with the CBC interpretation actually reinforced one another beautifully in this case. Ultimately, Libby was a dog that initially presented with that vomiting and aspiration pneumonia. She did improve with appropriate treatment and hospitalization, but then returned clinically ill after discharge, despite radiographic improvement in her pulmonary disease. The key clue for Libby's case was the lack of a classic stress leukogram at that recheck. Right. So on her CBC, she lacked the lymphopenia and eosinopenia expected from increased glucocorticoids in the face of this sort of prolonged inflammatory disease. That prompted cortisol testing, which did confirm the atypical hypoadrenocorticism because she did have normal electrolytes.
And I think that's the biggest takeaway here, right? Never ignore an abnormally normal CBC in a sick dog.
Exactly. Sometimes the absence of an expected physiologic response is the most important abnormality in the entire database.
Thanks, everybody, for joining us for another episode of Tales from the Lab. We'll see you next time.
Listen to new episodes of Tales from the Lab wherever you get your podcasts. And now you can also watch us on YouTube and Spotify.
Be sure to like and subscribe for exciting new content. Share new episodes with your colleagues and follow us on Instagram at Tales from the Lab. That's TAILS from the Lab. We're grateful you're here.